the first thing we're gonna do is discontinue this IV. So we're gonna say that this IV's got issues. It's not working. How do we know if an IV is working properly? What's the best method of determining that your IV is working properly? Flush it and get a blood return, right? So aspirate for a blood return and then flush. And when you're flushing, you're feeling for resistance. These are mediums? My hands are not that big. Wow. So when you flush it, you're feeling for resistance and looking for swelling or leakage. And if you don't have any of that, then it's probably fine. But we're gonna say this person's going home and they no longer need their IV. So I would make sure I had an order saying discontinue it. Please don't send patients home with IVs. Had home health patients. I walked in and they had an IV that must have forgotten to take it out. It's been in for like a week and a half. You know, you're like, with blood all back in it, and the person's always having infections anyway. One of mine had a central line. I went to listen to her lungs, and I'm like,
Oh.
She goes, oh, I forgot that was in there. How do you forget that? So you would remove the tape. Can we delegate removal of IVs?
No.
No, because we need to, according to your book, the nurse needs to assess the tip to make sure it's intact. So if I had fluids going through here, I would turn those off. Let me go ahead and clamp this. And
Sometimes that stuff, like I remember I was in the hospital, I had to like get the tape off, and I'd use like a little alcohol swab to kind of swab the tape off
swab it
because
down.
they don't want to rip their skin right off. Man, some of these people are so old. They're like
old
parchment paper.
and they're on prednisone and stuff, and their skin's so fragile. Now this is something you frequently don't see in practice, is you're supposed to cleanse the site before you remove the catheter. And then you apply some pressure, pull it out, hold pressure for 3 to 5 minutes, and check your tip. So you guys will all do that next week. You'll come in and discontinue your IV and check your tip, hold your pressure for 3 to 5 minutes, and then I will dispose of this in sharps or biohazard. And we're gonna say that that's done. You could put a Band-Aid over it. Any questions about discontinuing the IV?
Do we have a sharps in here?
Do we have a
Yeah, it's all the way over there. Oh, never mind. It's right there. Just kidding. Oop.
Since it's fake blood, we don't have to worry about it too much here, but, okay. So then I'm gonna gather my equipment to start my next IV. And we could start, let's start low on this hand. And you'll need your gloves, don't need that. Your gloves, your catheter, saline, your IV pack, and this is not the same thing, and your INT. So we're gonna say that this is a brand new INT. And it would be in a package just like this and sterile and have a cap on the end. Okay. Before you don't have to wear gloves until you actually are going to expose yourself to blood, okay? So you can get all your equipment out and all that kind of stuff before you put your gloves on. And different IV kits have different things in them. Some of them have gloves in them, and I always like the gloves that are in them. Those green ones, they fit nice and snug, and some people hate them, so it's all personal preference, whatever you want. Okay, so I have a label in here to label my person's name with, an OpSite dressing, a clear dressing. Your book and your checklist cover also gauze dressing. You won't be required to do that for us. It's just going to be the OpSite dressing that you'll be applying. A ChloraPrep to cleanse with. Some of them have iodine in there too. Some gauze, your tourniquet, and a really small amount of tape. Put this in here and act like that's sterile. Okay. So for your tape, it's easier to tear your tape without your gloves on. And because these bedside tables aren't clean, they like for you to put a piece down that you stick the tape on so it's not sticking directly onto the table. Because frequently there's a lot of stuff already on that table. Okay, and so I don't have any active bleeding here, so I can kind of palpate around. You should apply your tourniquet 4 to 6 inches above where you're planning to stick. They love that question. Exams, quizzes, 4 to 6 inches above where you're planning to stick. You just cross it over and tuck it. And then you can kind of feel around. And that's a very unnatural IV, horseshoe-shaped IV there, but I think I'm going to go for this right here. So then you undo your tourniquet, because we only leave the tourniquet on for 1 minute. Otherwise, it's considered a safety violation. Now, the only way you have to retest is if you forget to take it off. If you leave it on for more than 1 minute, putting it in, tell me I should have only left it on for a minute. But in the end, if you leave it on and you don't take it off at all, then you have to retest. So remember to take it off. Okay, I'm going to go ahead and get my INT ready. So to get it ready, I'm going to flush it, because right now it would be sterile on both ends, but it is full of air. So I'm going to flush it with normal saline. And then we'll clamp it back off. I'm going to leave the saline attached to it. And then I'm going to put the tip, keep the tip sterile back in the package close by. Okay. Since I can only leave the tourniquet on for a minute, I'm going to go ahead and cleanse it before I reapply that tourniquet.
So do you normally put the tourniquet on, kind of find the vein you want to go for, and then take the tourniquet off?
And then take it off and then reapply it right before you stick. Okay, depending on what type of cleanser, you might have alcohol preps, you may have iodine, we have chlorhexidine, and it's the ampule that you bust. And then you do like a vertical and horizontal scrub, and then a bullseye in the center, and let that dry. And while that's drying, I'll look at my my IV catheter here. So you can see there's some pads on each side of it. Those are for your thumb and your middle finger to hold on to, because they help you to grip. And then you use your pointer finger for this piece on the top to push it in and out with. So if that piece on the top, that hump is on the top, you know that your bevel, your needle has a hole in it. You know that that bevel is up. So that's the way you want to go in, is bevel up on top. And if that hump's on top, the bevel's up. Now sometimes when you take it out, it'll be like this, where the catheter goes past the needle. So you need to you can't puncture the skin that way. So you need to make sure that it's down. And then you have a little area here, it's like a little chamber that'll fill with blood when you're in the vein. So you know that you're in the right place. And I'm just going to stuck myself there. Okay, so Mr. Smith, we're ready to stick you now. So I've got my bevel up. I'm going to reach below where I'm sticking with my thumb and anchor the vein. That way it doesn't roll around from me. And then I'm going to go in at a low angle, say 15 to 30 degree angle. So big stick, and then see my blood comes back. So once I get the blood flash back, I know I'm in the vein. I'm going to lower it, put it in a little bit more, say another 1/4 of an inch, and then start separating, because I want the catheter to stay in the vein and the needle to come out. So I'm holding my grip pads and I'm pushing with my finger while I'm pulling out with the grip pads. You see that? Okay, so you want it to the hub, and then you're going to click it for safety. Now my needle can't stick anybody. Did you hear the click? At this point, you want the tourniquet off. Okay. So now I'm going to put this piece on here. So I'm going to apply